Miss Breckenridge. My name is Tasha Swanson. I'm your student in your health assessment course, as you probably know. But I'm sending this to you for the lab for the head, eyes, ears, nose, mouth, and neck and pharynx assessment right now. And the first thing we should always do as part of any kind of physical assessment, no matter what body parts we're going to inspect, is inspection. We should always inspect and look and see the condition of the patient. Now, this is my mother, for all intents and purposes of this video. I'm going to do this assessment on her, as you can see. Well, I'm inspecting her face. I noticed that she has some moles on her face. That's her skin. She has multiple moles on the left eye. Underneath the left eye, she has one on the right eye, with two on the right eye. And she pretty much, her skin is in good condition. It's moist. It's not dry. It's kind of oily, actually. That's called sebum. Her sebaceous oil glands are working. And then we would do palpation, auscultation, and percussion. I had to think. I'm a little nervous. And percussion. We will only well, doctors are typically the ones that percuss. I only use the three main ones: inspection, palpation, and auscultation, as a rule most of the time. Only in certain situations will you do the other one. In any case, I'm going to start with her head, and I'm going to feel for bumps, lumps, anything that feels abnormal. I'm going to inspect her face to make sure it's even on each side, to make sure that everything is symmetrical. And she does have symmetry on both sides of her face. First thing I'm going to do is inspect her eyes. And what I'm going to do is I'm going to look at her eyes, and I'm going to inspect her eyes for dilation and constriction. And then I'm going to follow by doing accommodation to light, to distance, and near objects. And I'm also going to do the 6 cardinal fields of vision. Okay, so I'm going to start with the light. What I'm going to have you do, Mom, I'm going to have you look straight ahead like you're doing, and don't look anywhere unless I tell you to do so. And I'm going to shine a light in your eye. And I'm coming from the side. And there was that pupillary constriction to the light, and I'm going to do the other side. They did. I did do that. So her pupils are round, reactive, and I'm going to check for accommodation right now. So, Mom, what I'm going to have you do is I'm going to have you focus your eyes on that doorknob over there. And really, your eyes, your pupils should dilate when you do that. Okay. Step back just a little bit. Just a little bit. Okay. So focus your eyes on that. They did. They were dilated. I shined a light and they reacted. Now, focus right here on my finger. And they should constrict when you focus on the finger. And they did constrict. So her pupils are reactive to light and accommodation. Now I'm going to check her cardinal fields of vision. Mom, look straight ahead at the camera. Just look straight ahead. And what I'm going to do is, I'm going to go, you see the tip of this? I'm going to ask you to, when I go up with it, your eyes have to need to follow this, okay? Alright, she passed. Alright, also, I'm going to check and look inside of her ears. I have a otoscope and an ophthalmoscope, as you can see, and I'm changing my little attachments on it. I had this for a birthday gift, well, for my finishing nursing school, the first time gift for my aunt. And now I'm so glad that she got me this, because it makes it a lot easier for me to do a lot of stuff at home, whereas if I didn't have this, I would have to do it at work, or I would have to go to a doctor's office and use something. Sorry, I'm having a little trouble. Okay. And now I'm going to look in her ears, and I'm going to check her ears for, look at her eardrum to see if she has cerumen impacted. And what I'm going to do is, I'm just going to check the outer part, the cartilage part of her ear. I'm also going to do what was called a whisper test to see if she can hear me whisper in her ear. I'm going to occlude the ear, and I'm going to try to whisper, and I'm going to put my hand over my mouth, and I'm going to whisper 3 letters, and she has to repeat them while I'm doing that. So I'm going to look at her ear first and to check to see, look at her tympanic membrane to see if I see everything I need to see. I do see a little bit of cerumen right at the edge of her ear. And she has a lot of it in this ear. And what you do is you pull up, you pull out and up to see. And on children, you pull down and back to see. But she does have quite a bit of wax that is kind of impeding me from actually looking and actually seeing her whole tympanic membrane. So, in this ear, she does have impacted cerumen. Now I'm going to look at her other ear to see what I see. And I see another ear that's full of wax as well. And I'm able to move it. It's not hard wax, it's soft wax. Oh, and I do see her tympanic membrane this time. Past the wax. I'm sorry. And it's shiny, it has the parts. I'm going to try and look again at her other ear to see if I can see what I... Oh, Lord, man. I looked it up for your ear. You should say it. I do. I'm sorry. I know it's kind of deep. I'm sorry. Now. I'm sorry, man. Alright, I'm going to do the whisper test now. And that test will include me occluding my mom's ear. Can you hear me? Okay, I'm going to cover my mouth. And I'm going to whisper 3 letters to her. What did I whisper?
G and B.
And try again. What did I whisper?
B, C, P.
What did I whisper?
B, C, P.
Yep. Ding, ding, ding. Now I'm going to do the other ear. What did I say?
X, Y, Z.
All right. All right. There you have it. She passed. All right. The next thing I'm going to do is I'm going to look inside my mother's nose. And I'm going to look in to see what I can see in her nose right now. Alright, so I'm going to shine this light in her nose to see if there's a deviated septum or any of any kind, and see if her nose is patent, her airway is patent, it doesn't have any occlusions, and then if I'm looking for symmetry as well. And I see hairs, there's no drainage, no redness, no swelling. And right now I'm gonna palpate her frontal sinus, and it's soft and flat, and her maxillary sinuses, and they're soft and flat right now. Now I'm gonna look in my mom's mouth to see if there is any teeth or anything missing or anything like that. Mom, open your mouth, say ah. Say cheese.
Cheese.
Go ahead. And she does have some teeth missing. Say ah. Kind of hold your tongue back. She does have some teeth missing on her bottom and upper jaw, on her upper gums. There are a few teeth left, so her gums are not swollen. They're not pain. Are you in any pain around your mouth anywhere?
No.
Okay. There's no pain. They're pinky. Her mucous membranes inside her mouth are pink and moist. She's hydrated. And the next thing I need to do is feel her neck. And I should never put pressure on her two carotid artery sites, because if I do, I can make her pass out. So I should only assist one. And you're supposed to feel a thrill and hear a bruit. And I don't feel a thrill. And I'm assessing them one at a time, because I don't want to make her pass out. There's symmetry on both sides of her neck. There's no external wax coming out of her ears, but she has quite a bit in her ears. And that's the end of my exam.